March is Colon Cancer Awareness Month, and even though we're in the midst of a pandemic, it's so important to stay on top of your health. Here to tell us what signs and symptoms we all need to be looking out for are medical oncologist Dr. Neel Dharia and Dr. Amikar Sehdev with Ironwood Cancer and Research Centers. Good morning, gentlemen. Thank you so much for joining us.
Good morning.
Good morning, and thank you for having us.
So, Dr. Dharia, let me start with you. What is the impact of colon cancer?
The incidence of colon cancer has actually been rising in younger individuals, which is why the American Cancer Society has been advising to start screening at the age of 45. The death rate of colon cancer has actually been decreasing over the last several years. And I believe this is most likely due to better screening and better treatment options. I think the most important thing to keep in mind, everybody should be screened.
So Dr. Sehdev, let me ask you, what are the risk factors, and is there anything that we can do to try and prevent it?
We don't know the exact factors in someone, but general factors that lead to increased risk are conditions or health diseases such as inflammatory bowel disease, diabetes mellitus, being obese or overweight. And also, if you have a personal history of polyps, or cancer yourself, or a family history of polyps or cancer, or there is an inherited risk factor. There are genetic syndromes that predispose someone to an increased risk, such as Lynch syndrome, and there are other ones. And most importantly, colon cancer, like most other cancers, is a cancer of increasing age. So most of the colon cancer happens in people who are more than 90 years old. And lastly, ethnicity also plays a role, like Dr. Dharia said. It's more commonly seen in terms of incidence as well as mortality in African American people, as well as in Ashkenazi Jews. So some things you can do that will help protect you towards getting a colon cancer and other cancers. So obviously you can limit the tobacco and alcohol use. You can eat healthy and maintain a healthy body weight. And usually high fiber diet rich in fruits, whole grain cereals has been shown to be protective. And also some drugs such as aspirin and other non-steroidal anti-inflammatory drugs like ibuprofen has shown to be protective.
So, Dr. Dharia, how can we screen for colon cancer? What do you advise?
There are several techniques to screen for individuals. The most important are either a fecal-based test or direct visualization test. There is also the multi-targeted DNA stool test, which is now available and can be done once every 3 years. And my important thing is, if any of these are positive, you need to have a colonoscopy done. The direct visualization tests are either doing a colonoscopy once every 10 years, or doing a virtual colonography or a CT colonography, which can be done every 5 years. Or one can do a flexible sigmoidoscopy once every 5 years. The important thing is talk to your physicians and find out what's the best screening technique for you or as an individual patient.
Exactly. We all want to catch it early. So, Dr. Sehdev, what is, like, if somebody is diagnosed with colon cancer, what are some of their treatment options?
We have the standard chemotherapy and many newer regimens which are giving better results. Most of the colon cancer, if caught early, can be cured with just surgery alone. Sometimes you may need surgery with additional chemotherapy for certain duration, maybe 3 months, maybe 6 months. The other newer things in terms of treatment is the use of genomics and immunotherapy. So there are drugs that have been developed for certain mutations that can be, obviously used to one's advantage. And in certain mutations, immunotherapy works really well also. Secondly, there is another challenge to do biopsies. Sometimes they're hard to do. Sometimes they're, dangerous. They have side effects. So what you can do in those cases is newer techniques like liquid biopsies. This technique is coming along and has shown a lot of promise.
So there are a lot of treatment options, as you said, but of course, catching it early. We all need to start screening for it at 45. Gentlemen, thank you so much for joining us with this life-saving information. We really appreciate it. And if you want to learn more information about Ironwood Cancer Center and Research Centers, they have 10 Valley locations. All you need to do is head to their website, ironwoodcrc.com, or call the number you see right there on your screen.